And we are live on YouTube. So today, our YouTube people get to hear about different resurfacing options. And what is resurfacing used for? Who can tell me? Fine lines and wrinkles, brown spots, acne scars, texture of the skin. Yes. What's that? Oh, I'm in the shadow. Is that? Oh, that's great because it's right in my eyes. The light is right in my eyes. That's perfect. Okay, so it'll help get rid of fine lines and wrinkles, brown spots, acne scars, and you're at Contour Dermatology, and we really have the best technology out there. So the first thing we're going to be talking about is why do we age? And you all know that you don't look the same as you did 10 years ago, and you all are so young in this group that you probably might maybe even look better than you did 10 years ago. But once you get into your 40s, you look back at your pictures when you were 30s and you're like, oh, what happened to that person? And when you get into your 50s, you're like, wah, I looked like that when I was 30. And then when you get into your 60s. So as you get older, you actually do develop fine lines and wrinkles and brown spots and sags. And so things that happen are there's just the intrinsic fact that you're getting older, so you start to look older. But also things that can accentuate that or accelerate the aging process include smoking. You all have seen smokers who've smoked for years and they're more wrinkly than a person who hasn't smoked. You can also, excessive use of alcohol, poor nutrition, and 80% of aging is attributed to sun exposure. So we live in the desert, so make sure you're wearing sun protective clothing and also wear sunscreen every single day. Now, the aging face, we can see when you're young and tight, everything looks great. There are very few imperfections in the skin, no wrinkles around the eyes. But as you get older, the texture really changes and you start to get fine lines and wrinkles and you start to get the sagginess of the skin. So what can we do to improve this? Well, at Contour Dermatology, we have invested in technology. And we have had 3 treatment options in the past. We have the CO2 laser, which we're going to be talking about. We have the Fraxel, we have the Sublative, and we're also going to be talking about our new Lutronic erbium laser. Okay, so the first thing that we're going to talk about is our fractional CO2. Now, this is really the gold standard to get rid of fine lines and wrinkles and brown spots and just make your skin look a lot better. Now, the first word is fractional. And can anybody in the audience tell me what fractional means? Fractionated. What does that mean, though?
Like light increments?
It's dots. So what it does is instead of ablating or destroying the entire skin surface, it pokes holes in the skin so it leaves some normal skin intact. And we'll be talking about why that is important. So the fractional CO2 is highly absorbed by water, and skin cells are 90% water. So what this does is it destroys the skin cells, right? And so fractional means that it's poking holes. Instead of just scraping this entire skin surface here, it's just poking little holes. And that leaves this normal skin intact as well. So it treats wrinkles, pigment, scars, fine lines. Now, when we talk about lasers, I'm going to give you a little bit of a physics lesson here. So lasers target different things, and those things are called chromophores. Am I in the right light, May? Are you watching out for me? Okay, so when we talk about chromophores, there are things that lasers target. Now, there are 3 things in the skin that we're going to target. We're going to target blood, we're going to target water, and we're going to target pigmentation. So for blood, what are we going to treat when we target blood? Red. So we're going to treat veins typically, or redness in the skin. If we're targeting pigment, what are we going to be treating? Brown. So brown spots, we're also going to be getting rid of hair because hair is pigmented. Or tattoos, exactly. Is that right, May? Okay, May is my guide. Thank you, May, for making me look good. Okay, so with this, because the skin surface is 90% water, we're using the water absorbent lasers to treat the skin and get rid of the superficial layers of the skin. So what the CO2 does is it vaporizes tissue, means it's just ablating it, and it also has heat with it. And that's the one thing that makes this laser unique over the other resurfacing lasers that we have. The radio frequency is heat, but it's not the same kind of heat as the CO2. Because it heats the tissue to such a point, it can shrink the skin up to 30%. And if you ever watch this treatment being done, you'll see the skin actually shrinks up as we're doing the treatment. The other thing is, by destroying the tissue, you stimulate the body to create new collagen. And when you get new collagen, that new collagen is healthy. And so what that means is your skin is less wrinkly. So it's shrinking the skin and stimulating new collagen fibers in the skin. Okay, and so this is really what this is doing. So this laser causes ablation or destruction of tissue that vaporizes here, then it leaves this zone of heat underneath. Now that zone of heat is important because it does a couple things. It coagulates the blood vessel, and it stimulates those fibroblasts to produce new collagen and elastic fibers. Okay, and so when we talk about the fractionated technology, with the device that we have really forward? Okay, how's that? Is that good? In the light? May told me to stand on the light.
No, I was just saying that you have to keep the side.
Oh, okay.
The presentation is like
Oh, okay. Thank you. I'm embarrassed. Should I start over again? No, I'm just kidding.
it's live.
No, I know. You've embarrassed me in front of, what, 10 people? And the entire staff. Okay. So with the fractionated CO2 that we have, this is really the gold standard. This laser is it's a beast. I mean, this laser costs about $170,000. I mean, this is really the laser you want to use if you're going to do resurfacing. And so it has different settings that we can use. And so it can be superficial setting where it damages the superficial part of the skin, or it has a deeper setting where it can go deeper into the tissue. And I'll show you a picture of that, what that looks like. Or what we can do is we can do the deep and the superficial. Now the deep is really used more for deeper scarring, and the superficial is used to get rid of the brown spots and the fine lines and wrinkles. But we can do the whole package. And you can see here, the superficial just goes superficially in the skin. The deeper goes deeper in, drills really deep, or you can use the combination. So if you have really bad acne, what we're going to want to do is we're going to want to do the total. Now, in the old days, we used to just ablate the entire skin surface. Remember how I said you'd scrape the entire skin surface? Well, with fractionated technology, what we do is we just leave little zones of skin intact. Now, why is this important? Back in the old days, what would happen is if you scrape this entire skin surface, you would also damage the pigment cells in the skin. And if you damage those pigment cells in the skin, what would happen? Well, you'd have loss of pigmentation, and then you could also have scarring because there were no healthy skin cells left to repopulate the area. So that was a much riskier procedure, and you guys are too young to know this, but the people used to be intimidated by having a CO2 resurfacing because they didn't want to look white or scarred. And that was what happened with the old technology. Okay, so we talked about that really. And with the CO2 healing process, the cells in the surrounding area that are not wounded help to heal those wounded areas. And also, if we destroy the entire skin surface or a lot of it, the cells in the hair follicle actually migrate out and help to heal the area. So this is an interesting thing because if you go too deep, everyone's like, well, if you want to get a really good result, why don't we just go really, really deep, right? Just like burn that skin up so we can get rid of all those fine lines and wrinkles. Well, the problem is if you go too deep and you damage the hair follicles, the structure here, what will happen is there's nothing to help aid in the healing process and you'll get scarring. So this is a very precise technology, and this is what's so great about it, is we can cause enough wounding so we get a great result without damaging the skin so much that we get loss of pigmentation and scarring. So the other thing, this is just kind of cool what they did. I mean, this is, technology is always advancing. You guys know this because you have your cell phones, right? Well, with a laser, the way it used to do, it would put little dots of heat, dot, 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 dot. And what would happen is when you just put the dots of heat in a pattern like this, it heats up the tissue. Whereas now what they'll do is it'll do a dot here, then a dot over here, then a dot over here, then a dot over here. So it lets some of the heat dissipate. And the reason this is important is because if you put too much heat in one area, again, you're going to have more damage and you can have a higher likelihood of having scarring. So super duper technology, right? And the nice thing about this laser also is that you can calibrate how big those spot sizes are that you're putting on the tissue. So you can do little ones so you have a lot of normal tissue in between them, or you can make the spots bigger so there's less tissue in between. So the more wrinkly you are, the more brown you are, the bigger you want those spots to be, so the more surface area you want to cover. Okay, so some of the side effects are the reason everybody doesn't want to do this is because there is some downtime. So that's really the only real disadvantage to doing this. And the other thing is, if you're a darker skin type, there's a chance that you could get pigmentation changes. So, that's the other disadvantage. But a lot of people don't have 7 to 14 days to heal. So if you're a very active person, if you live in the Coachella Valley where you're always having a golf tournament or some event that you want to go to, or you want to play tennis all the time or whatever, this can be too long for some people. And during this period of time, guess what? You have to stay out of the sun. You have no sun exposure whatsoever. So if you're out in the sun, you have to wear a big hat, and we prefer you not to even go out. There's some redness that can persist. For most people, it's going to be for about a month, but for some people, it can be up to 3 months. You can get pigmentary changes if you don't pre-treat with bleach and Retin-A, because we want to calm those pigment cells down so that when they get traumatized, they don't get overactive and cause brown patches on your face. There's a risk for infection. Very, very rarely. I've only seen a couple, but we want to be very careful with this because it could lead to scarring. There's also some swelling that goes on, and that'll last for about 5 days, and you can also get some textural changes. Now, because I said the Fraxel, the CO2 has downtime, some people don't want to take that downtime. It's just not going to fit into their lifestyle. And some people are just intimidated by it. There's no real reason to be intimidated by this laser because it works so great, but some people are intimidated, so they want something a little more gentle. And that treatment is going to be our Fraxel. So the Fraxel is a non-ablative laser, so it's not destroying your tissue, it's just wounding it. So it deposits heat. It does require more treatments because less downtime, more treatments are required. So instead of having a one and done, you have to do 3 to 6 treatments typically. And with this, you're having less surface area covered. With the CO2, we can make it up to 100% of the skin surface, but with this one, it's more like 30%. And that means it's less dangerous again. Okay, this one targets water, just like the CO2, because 90% of the skin cells are water. And it's for fine lines, acne scars, texture changes, and also pigmentation. So it's very similar to the CO2. It was actually FDA approved for melasma. If you have melasma, don't try this laser because a third of people with melasma will get better with this device, a third will stay the same, and a third will get worse. And if you get worse and you have melasma, it's really a disaster. Okay, and the other thing that's great is this is safe for all skin types. Now we have to be careful when we want to pre-treat, but it can be used in brown skin as well as lighter skin types. So the side effects, I love this device. I get it done all the time. It can lead to some swelling, a little bit of redness. It can change the texture of your skin, but we always want to pre-treat with bleach and Retin-A to make sure there's no pigmentation changes. Let's see here. So the Fraxel, one of the things that's really the advantage with this device is off face, the CO2 laser is so powerful. If you get away from the face where you have a really great blood supply and a lot of hair follicles, the further you are away, the more risk you have of developing scarring because that device is so powerful. The Fraxel is very safe anywhere off face. So if you need to improve your neck or your décolleté or your arms, there's nothing better than this device. And again, I use this on all those areas because I just want every place to look great. And as you get older, you don't want your face looking great and your neck and hands looking horrible. It's a telltale sign. Look at the hands and look at the neck, right? Okay. So comparison, I think we've talked about that enough. You can see these devices go to different depths in the skin. So we can adjust these so we can get better results by going a little bit deeper. Now, the last device I want to talk about, well, not the last one, but the last big one I want to talk about is the sublative. And this is a radio frequency device, which is different than a laser because this is strictly heat. And the reason this device is so great, and the reason we got this when we have two great options, right, is because this one is completely colorblind. And there's absolutely, basically no downtime than some pinpoint little dots on your face. So this is great for people who are darker skin type, and we live in a multicultural society, so we don't want to have devices that are only good for blonde, blue-eyed people. So this one we can use on everybody, and also you don't have any aftercare instructions. So you can get this device done, and you can go play golf, you can go for a run, you can go for a hike. So that's one of the nice things about this device. And you don't have to put goo on your face or do any special aftercare instructions. Okay, so what it does is it heats the tissue, leading to neocollagenesis. And it's very short downtime, just those little scabs, little dots on your face, and it does require multiple treatments with this one. And this is traditional resurfacing where as the heat goes deeper, it sort of becomes less powerful. So it starts to cool off. So you have less damage in the deeper tissue. Whereas with this one, you just have a small amount of damage on the surface, but it heats up the deeper tissue. So with a Fraxel, the energy is mostly up here. With a sublative, the energy is deeper. So if you're not going to get a CO2 where you get the deeper wounding all in one, the superficial and deep with a CO2, I like to combine the sublative, which has a deeper heating, with a Fraxel, which has a superficial heating. So to me, they're a great combination. So a lot of people are like, which one should I pick? And if you're not going to get the CO2, the big daddy that's going to really give you major results, I like to do the combination of the two. And I just want to introduce our new box. Let's all get excited. We just got a new device. And we love to get new devices at Contour Dermatology. This year we got 2 new devices, and so this is one of them. And this is an erbium, and the thing that's great about this one, as opposed to the others, as opposed to the Fraxel, it's minimal pain and almost no downtime. And we'll be doing a subsequent talk about this one. And who's going to be doing that? Do we have a volunteer yet? Is it Laura? Laura's not here, so Laura's going to be doing a talk on the new device. Okay, so also I just like to talk about, combination therapy is also a big thing here at Contour, and we have really experienced laser nurses who are really good at this. But let's say you do a CO2. What's a great combination with a CO2? The IPL. Why is that great? Because the IPL will treat browns and reds, but so if you're red after a CO2, you can get rid of the redness by using the IPL. So it's a great combination. Also, if you do the CO2 and you start going out in the sun after you've healed, guess what's going to happen? You're going to get brown spots and some wrinkles coming back. So this is a great maintenance therapy. And the way I always tell people this is, if you go get your car detailed, is that going to last forever? No. In a couple weeks, you're going to need to get the interior cleaned, and then once a year, you're going to want to do the detailing again. So this is a really good maintenance treatment. And also, as I mentioned, the Fraxel is superficial. If you don't want to do the one that's the most aggressive, then we can do the Fraxel, which is superficial treatment for fine lines and brown spots. But if you really want to get a great treatment, you do the sublative because it's going to do more deeper wounding, which means more reduction of fine lines and wrinkles. Yes?
When you say Fraxel plus sublative, do you do them both at the same time, or do you
spread them out?
Fraxel a week and then sublative?
Yes, that's a good question. And the answer is, traditionally we'd say let's wait because there's heat with both of them and we want to minimize the risk. And when you're combining heat, you have to worry about that. But we have Lee Irwin at the back who decided that he was going to do them together, and it worked out great. And so, we should write up a case report about Lee Irwin and how great he looks. And then I also say, even if you're going to do these two in combination, again, IPL is great for maintenance because you've invested that money. This is living tissue. It's not going to stay perfect if you do one treatment. So maintenance with IPL I think is great. And I also think doing products is also extremely important. If you're going to spend that money to do these treatments, believe it or not, the Obagi system is called what? What's the name of the box? What is it? The transformation kit, because it really does transform your skin. And so I really believe that you want to maintain your skin by just doing the Obagi. Now, we're going to have a quiz to see who paid attention. Uh-oh. Will just rolled his eyes. So Will, you get the first question. Congratulations, Will. Because I know you're competitive, Will. Did you know Will is called an elite softball player? Do you know what that means? It means he's one of the best in the country. Okay, so the first question is, name 2 of the 4 resurfacing devices we talked about. 2. And? Bravo. Good job, Will. So you have other talents besides softball. Okay, number 2, most aggressive. Let's go for Natasha.
CO2.
CO2, correct. What is the a less aggressive one? Carter. Sublative, very nice. What are the side effects of the CO2, Leah?
Redness, swelling.
Perfect. Yep. Okay. Number 5 is let's see here. Jessica. Does the CO2 treat discoloration? Yes. Okay. Number 6, does the Fraxel require multiple treatments? Asia?
Yes.
Yes, okay. How many?
3
3
to 4.
to 6, yeah, exactly. Number 7, does sublative require multiple treatments? Anna?
Yes.
Yes, typically 3 to 5. And what is the type of technology of the sublative? Jessica? Radio frequency, yes. And is a sublative safe for all skin types? Let's see. Jose? Yes? Okay, excellent. You guys are now experts in resurfacing. Are there any questions at all? Nope, okay. Thank you so much, and thank you for tuning in.